Today the topic for the CME is amniotic fluid sludge and its significance. Now this is a transvaginal scan which is showing you the cervix, internal os here, external os here. This is the cervical length and this is the amniotic fluid, and you can see echoes within the amniotic fluid, which you must be knowing that they can suggest meconium, they can suggest even vernix caseosa, or they may be just idiopathic without any significance. Now, these echoes are different from this area. Now, if you see here, you find that this is thick, just like the sludge we find in the gallbladder, and this is referred to as amniotic fluid sludge. Now, if you press with the probe or you just try to dislodge it, it will break into particles, but again, it will recollect like a ball here with echoes much thicker than this area, which are very, very common. Now, these echoes are very common and they are different from this particular area. Now, the second question arises, what is the significance of this? Now, once the sampling was done and assessment was done of this area, it was found that a lot of bacteria as well as neutrophils, a very high percentage of neutrophils. So basically it is having germ cells, microbes and inflammatory cells. Now this has been seen to represent inflammation or infection. Now, significance of this is that it may be associated with a short cervix, and in many cases it leads to early abortion, or I'll say early delivery. So it can lead to a spontaneous delivery much earlier, preterm delivery, and the fact that it has an association with the infection means that it can lead to sometimes complications as well. Especially when it is associated with a short cervix, the chances of preterm labor are high. So when there is an infection which is associated with this amniotic fluid sludge, in that case antibiotic has to be started. Now it has been seen in most of the cases that with antibiotic this amniotic fluid sludge has been seen to decrease in size or altogether disappear as well. One of the important thing is that the sludge is usually not associated with any clinical features. So it's a subclinical condition, but it has a risk. So whenever you see such a sludge, be careful. If antibiotic has to be started, you start, and you have to be cautious, especially from the angle of premature delivery. So that's it. Thank you.